Hello everybody, and welcome to the Thursday edition of Video Clips. And I picked a topic that might sound a little bit unusual, but I think you'll understand why I think it's important to talk about, and that's loneliness and its impact on health. Good relationships and social connections have been proven to be a positive influence on both mental and physical health. On the other hand, loneliness has been shown to have a negative effect on health outcomes. And when I started looking into this, I'll tell you what inspired me to do it, is that we covered in an advanced study class a book called Choices in Healing, written by Michael Lerner. And in the book, I mean, it was a ginormous book. We did 4 classes on it. But in the book, he had a very lengthy section that concerned the effect of social interaction and support and connections and this sort of thing, specifically for women with breast cancer, not because other people with other types of cancer or men wouldn't get something out of it, but that just happened to be the area that is the most researched. And I was astounded. I read some of the studies that he referenced, and I was astounded at the profound effect that support groups and yoga and social interaction had on women. It actually lengthened their lives who had breast cancer. And so I thought it would be interesting to look into it, and so I did a couple searches just to see what I could find. And the first thing I look at is there enough out there to write about? Well, when I Googled research studies on loneliness and health, the issue wasn't there's not enough to write about. The issue is, oh my gosh, how can we turn this into a short video clip instead of writing a book about it? Maybe somebody should write a book about it. I've actually thought about doing it. So here's the bottom line. I'll just tell you what I found, and I just created an overview about the whole thing, and I have some suggestions. Well, the need to connect is innate, and it is very important to people. And I found one study that this actually made me feel terrible, that the people who were lonely in this study were describing their experiences being similar to feeling physical pain. And in fact, a study showed that if lonely people are given painkillers, they report feeling better. So they actually feel some of the loneliness in their physical body, which is just devastating to think about it. Well, unfortunately, more and more people are suffering from loneliness for a variety of reasons, and of course it affects quality of life, but it also, as it turns out, affects your health and can even increase your chances of dying of a disease. Well, a new study looked at the prevalence of loneliness and the connection between loneliness and health in primary care practices in 2 networks. So there were 16 practices in all that participated with over 1,200 patients, and the researchers reported that 20% of the people that they talked to or surveyed were lonely. Factors contributing to loneliness included being divorced, separated, widowed, or never having been married, and that's to be expected. Those who were unemployed, sick, disabled, also more likely to be lonely. The risk of loneliness increased with primary care office visits, urgent care or emergency department trips, and hospitalization. And also the prevalence tended to increase with age. And so I thought it was interesting, the more interaction with the healthcare system you have, the more lonely you are. And I don't think it's because doctors make you lonely. I think it's because being sick is a symptom of loneliness, and sometimes being sick, if you're lonely, you get sick, and then when you're sick, you don't feel much like spending time with other people, which makes you more lonely, which makes you more sick. I think that's what's going on here. There weren't any differences based on sex, race, or between urban versus rural dwellers. There was an inverse relationship between loneliness and health status from poor to excellent health, which remained constant after adjusting for all other factors. According to a survey of adults 45 years of age or older, the incidence is even higher, with fully 1/3 of them reporting that they're lonely. Reasons cited included lack of social support along with a shrinking network of friends. Those who reported being lonely were less likely to participate in activities that could lead to the development of a social network, and these would be things like religious services or volunteering or spending time on a hobby. The survey showed that lonely people were less likely to reach out to others when they were feeling lonely, and instead tended to eat, sleep, watch television, surf the internet, and actually go out alone. And so in other words, being lonely leads to behaviors that tend to lead to more loneliness. And so how do we interrupt this cycle? And I'll talk about that at the end. Respondents reported that the internet makes it easier to share personal information, but they also in turn said that the internet might be a contributing factor to their loneliness. 13% of people reported that they had fewer close connections since they started keeping in touch with people via the internet. In this group, poor health and drug use were also associated with loneliness. And this issue of the internet has been written about quite a bit. One of the things that parents are reporting is that, for example, contrasting with when I was a kid, our parents were always worried about getting home in time for curfew and where we were and who we were hanging out with and did we actually go where we said we were going. Parents are now reporting that kids are in their rooms and they're having relationships with their friends on their phone, like it's all Instagram. They're not going to the shopping mall with their friends and the movies and that sort of thing. And that's creating a very isolated person. So this internet thing, I think, is affecting a lot of people. Research has shown, and this is why we need to pay attention to it, that loneliness increases the risk of several health conditions. And by the way, I could have written about just this connection between specific health conditions in a dose-dependent manner, but the ones I found studies on were hypertension, cardiovascular disease and stroke, cognitive decline and Alzheimer's disease, and all-cause mortality. A national survey conducted by Cigna in partnership with a research firm showed that 46% of people say that they sometimes or always feel alone or left out. Over 48% of single parents report being lonely in spite of the fact that they live with children. Surprisingly, the loneliest group of adults is Generation X, the adults between the ages of 18 and 22. And this frankly surprised me. And to the point that I'm making here, these people also report being in worse health than previous generations. So younger people are lonelier, which is counterintuitive, I think, to what we would think. And they are recognizing that they are in a less healthy state than their parents. And I think all parents want their kids to be better off than they are. So you expect that your kids might have a healthier life than you, a longer life, a more prosperous life, and that's not necessarily happening for our kids these days. The impact of health issues on loneliness affects adolescents as well. Teenagers are increasingly suffering from chronic conditions. This results in a higher likelihood of mental health problems, and then having a disability can make things even worse. Health issues in adolescence tends to lead to loneliness, which then increases depression and anxiety. Sick kids are a lot less likely to participate in education and traditional activities, which feeds this downward cycle of feeling isolated and lonely. Boys, by the way, are more affected than girls in the studies that I read. For middle-aged and older people, the quality of social engagement is protective against loneliness, while for adolescents and young adults, the quantity of social engagements is more protective. So this means that different factors are influencing loneliness, and probably a one-size-fits-all solution is not going to be appropriate. Interventions in healthcare settings have been shown to help, and I mentioned earlier Michael Lerner's reports in his book on breast cancer patients who are placed in support groups. And so, for example, social recreation offered through a community-based mental health program to individuals with serious mental health issues resulted in significant improvements in participants' feelings of loneliness, self-esteem, social functioning, satisfaction with social relationships, and overall life satisfaction. Providing social support to cancer patients, I found additional studies, ones in addition to the ones that Michael Lerner cited. One study included cancer patients who had been determined to no longer benefit from traditional treatment. And boy, I can't think of anything worse than saying to yourself or having somebody say to you, there's no sense in doing anything more. These particular patients participated in 12 counseling sessions that lasted for between 1.5 and 2 hours, and then they also participated in regular group support sessions. In 5 out of 35 patients, tumor growth stabilized during or immediately after the sessions. 4 patients remained stable for between 3 and 9 months, and 1 remained stable for 2 years. 2 years after everybody's thrown up their hands and says there's nothing we can do for you, I think is significant. The relationship between personal connections and health illustrates, and this is why I'm talking about this, why healthcare practices need to not just focus on clinical diagnosis and treatment, but also the personal lives of the people who are being diagnosed and treated. According to former U.S. Surgeon General Vivek Murthy, quote, "During my years caring for patients, the most common pathology I saw was not heart disease or diabetes, it was loneliness." He went on to say that, quote, "Loneliness and weak social connections are associated with a reduction in lifespan similar to that caused by smoking 15 cigarettes a day and even greater than that associated with obesity," end of quote. So I think we do need to pay attention to it. Fortunately, some healthcare organizations are starting to pay attention, and I found some interventions that looked interesting to me. CareMore Health initiated a togetherness program to address loneliness in its senior population back in 2017. They made it available to the senior population, and over 700 patients voluntarily chose to enroll and receive weekly phone calls, home visits, and they were also connected to community activities. Well, the patients reported that the program was extremely helpful, and reading some of the quotes that they had in the story about this was just warmed my heart. Like this woman said, I was all by myself, and I started really looking forward to the phone calls and visits. Like that was the highlight of my week. First of all, it's sad that somebody thinks that a nurse calling you is the highlight of your week, but think about how impactful that is when that's the case. A more aggressive initiative is being implemented in the UK. Shared Lives is a home sharing program that connects retired people with younger people who need a place to live. So seniors who have extra bedrooms with college kids who need a place to live and can't afford one on their own, for example. I think that's a great idea. And then they have another program, Men's Sheds. It's a network of community spots where male retirees and unemployed guys can meet, socialize, and participate in activities like woodworking and electronics repair. There are many obstacles, as good as all this sounds, to widespread implementation of programs like these, and one is that healthcare visits are short, which makes it really difficult to engage in meaningful conversations with patients about their personal lives. Doctors often don't have an opportunity to form relationships with their patients that would lead to these types of discussions because insurance plans change and sometimes you have to change providers. And by the way, the doctors don't like this any better than the patients. Most of my friends who work in traditional healthcare settings are not very happy about this kind of thing. Healthcare training is a limitation. I mean, practitioners are taught to give instructions to patients, and they're really not given much direction about how to discuss personal and sometimes really uncomfortable issues. This is a limitation that deserves more attention and a proactive response, but I don't see this happening anytime soon, which brings us to what can we all do? Well, I think all of us as community members can respond to this situation because we know people who need companionship or help with household chores or errands, people who are going through divorce or separation or dealing with more time alone or just moved to your neighborhood or your city, and cancer patients who could use some help. And I think that we all need to reach out. In other words, and I found myself doing this. You know, if somebody asks me to do something and I can do it, I'll do it. But I often don't say something to people to ask them, can I help you with this? Or is there anything I can do to help you? And after I read Kelly Turner's book, Radical Remission, her book illustrated the importance of cancer patients asking for help as part of their healing process. And I've been more conscious of it since I read that book, but after doing this research, I'm even more conscious than I used to be about the importance of reaching out to other people. And then the other thing that I think is important is for those of us who are fortunate to have good social connections and a very rich social life, we need to really treat these relationships like gold and invest in them so that we don't end up being lonely people at some point in time in the future. And so as I was writing this, I had this, in preparing to make this video clip today, I had cut this thing out of the newspaper that I want to go see this art exhibit at the Columbus Museum of Art, and sometimes because I'm so busy, you know, I'll just drop into the museum and walk around when I have an hour to spare and that kind of thing. And I was kind of starting to look at my calendar for that, and I thought, you know what? I thought of a friend I haven't seen for a while. I thought instead of doing that, which is the efficient thing to do, I'm going to make the art museum an outing and call this friend and say, we can go anytime between now and the beginning of June, so let's pick a Saturday afternoon and go to the art museum together because we haven't seen each other for a long time. And I think that's a better way to do it. So I think we should all be conscious of how we can reach out to people who need help, obviously need help, and offer more. And we need to be a little bit more conscious and treasure the relationships that we have with other people and protect our own social connections more than we probably give any attention to under normal circumstances. All right, that's all for today and for the week. Hit the subscribe button. Pass this on to anybody who you think might enjoy watching it, and I will be back to you next week with more news.